our I-Team continues to dig into the risks that are tied to generic drugs made in India, exposing manufacturers who are careless, dangerous, and shockingly unchecked.
Now, amid growing scrutiny of the generic drug supply chain, senior investigator Lisa Fletcher sits down in an exclusive interview with two leading senators from opposite sides of the aisle who are forming a united front to try to fix a problem that affects us all.
Sure, you want the cheapest drug, but if it's made by somebody who could poison you tomorrow, do you really want to rely on that?
It's a risk our investigations have repeatedly uncovered. Millions of Americans rely on medications made overseas, primarily India and China, raising serious questions about quality.
This is how do we keep Americans safe, especially our seniors safe. That's what this is.
Fixing an unreliable drug supply system has become a rare bipartisan effort for Florida Republican Rick Scott and New York Democrat Kirsten Gillibrand.
It makes you mad.
Their first target? A bill requiring drug labels to show where medications are made, information patients don't currently get.
How would it actually work for patients when they go to the pharmacy counter? What would be different?
They would hopefully have access to a label. Where do the ingredients come from? Where was it manufactured? Can I trust that manufacturing facility? Does that manufacturing facility get oversight and accountability?
Right now, patients have no way of knowing. We reviewed hundreds of FDA inspection reports from Indian drug factories documenting falsified tests, contamination risks, and manufacturing failures.
We've talked to a lot of experts on this issue, and they love the country of origin labeling. But they think a missing element is that there's no quality metric embedded in that QR code that then tells people, based on these companies' history with the FDA, are they green, yellow, or red? Are they good history or bad history? Is including a quality metric something you would entertain as part of this?
Absolutely. Quality, anything else that would be helpful to Americans, we're always open to it, but we've got to get started.
So Americans understand that if this bill passes, this isn't the end.
Just the beginning. This platform idea that we're creating, that a label must be provided, is something on which we can build more reform over time.
Like changing how generic drugs are purchased, shifting production back to the United States, and rewriting a system that has long rewarded the lowest price above all else.
20 years ago, you asked any Fortune 500 CEO in America, and their opinion was, we need the lowest cost of all inputs for all things at all times. And I will manufacture what I want, where I want, to get that lowest price. We have since learned that that is not good for America. And half of the world does not have your best interest in heart. You are screwed if anything happens, like a worldwide pandemic or a war.
Through the Senate Committee on Aging, they're pressuring federal agencies and industry to address weaknesses in the drug supply.
If you're serious about onshoring the manufacturing of generic drugs, what's it going to take to incentivize manufacturing here and really use that leverage to make the drug supply safer?
Well, there's a number of levers there that we have to use. We have a lot of buying power, and the DOD, the VA, has massive buying power.
CMS?
Yep, CMS.
Pretty much every federal agency that can buy drugs, we've talked to, and we've been talking to them, and they're receptive.
But unless these agencies are forced to do it, the manufacturers that we've talked to, they're afraid that if they make the investment and these agencies are not directed to buy American first, that they're still going to go over to India because it's still about the bottom line. How do you account for that?
First off, the consumer's going to make it happen. The consumer's going to drive this. If the federal government does its job and is a big buyer, then it'll be very good for these companies.
Let's talk a little bit about cost. Are patients going to have to come out of pocket a little bit to get safer drugs made here in the U.S.? A lot?
I don't think you're going to see significant cost change, and they're saving.
Every time a life is lost, every time someone becomes more ill because they didn't get the right medication, that takes enormous toll. The cost is massive. If you look at things on a macro level, this is something that's very worth doing.
Now, we've posted an extended version of my interview with the senators on WJLA.com. They tell me they hope to see meaningful change, Scott, by the end of this year.
Well, and that's optimistic, which is good to hear. But as you just pointed out in your piece there, Lisa, it's really just the beginning, right?
Oh, for sure. Gillibrand acknowledges that this could take years. This is a really complicated issue, which this bill just gets out of the starting gate. Pharmacy benefit managers who decide which drugs your insurance will cover and what you pay for them are deeply tied to this issue. And those closest to this problem tell us the PBMs must be addressed.
All right, now speaking of that, You just got back from Dallas, Texas, where
Yes, I
you were
did.
with one of the biggest critics of pharmacy benefit managers. You and I were talking about this just before the show started.
Right, yeah, I was with billionaire entrepreneur Mark Cuban, who's using his disruptive influence in this drug space. He had a lot to say about all of this. We got a rare look inside his new manufacturing facility, one of the few on U.S. soil. He's got big plans, and I'm looking forward to sharing that story with everyone in the days ahead.
Yeah, and we'll be anxious to see it because it's going to take a lot of people from a lot of different avenues to make this all work, right?
It is, absolutely.
Yeah, great work as always. All right, thanks, Lisa.